Hey everyone, it's Drew here back at ASAP's 2018. I am joined by Dr. Rappaport once again. Something that's really apropos given the drug epidemic today in the United States, dealing with drug addiction. Dr. Rappaport has a non-narcotic drug protocol that he gives to his patients that he's going to give us some insight about. So
Thanks,
take
Drew.
it away.
Thanks, Drew.
Yeah.
I've not been using narcotics at all on my patients for the last 7 or 8 years now, and it's always been a concern of mine in terms of the amount of narcotics and the effect of narcotics, dating back to when I was a medical student, being in an emergency room, resuscitating somebody coming in from a drug overdose one night, and then 3 days later being back on call and that same person coming in DOA.
Oh, wow.
So it's a memory that I will never shake.
Yeah. So this was 8 years ago, and that kind of...
Oh, no. This is probably 40 years ago when I was a medical student. But the issue
So when you were 5.
Yeah, right. So throughout my career, the protocols have always been to reduce discomfort. Narcotics are what were available, and people thought the more the better, and it just came to me that it's just not necessary, particularly
so what kind of narcotics?
In cosmetic patients.
What kind of narcotics are we talking?
Well, normal situations might be Vicodin or Percocet or something of that nature, and unfortunately, numbers were being sent out. Patients would have 30, 40, 60 tablets dispensed, and I just found that it was totally not necessary, particularly in cosmetic surgery, and I believe that it has a more expansive role. So my approach has been basically a total perioperative management, where we actually start medications which are a non-steroidal and something called gabapentin, which helps to reduce discomfort. Start that the night before and the morning of. We also include that with anti-nausea medication, and then use a combination of medications intraoperatively, so that effectively post-operatively patients are just still receiving the Celebrex that I'm using, or gabapentin, and up walking, no narcotic effect, no constipation, no irritability.
Yeah. Okay, so talk to me a little bit about the Celebrex and then the other one you mentioned. So they're still drugs that you're using to help reduce the pain. They're just not narcotics.
Correct.
Gotcha.
Correct.
Okay.
So these are medications that help to lower the pain, raise the pain threshold, you would say, so that, and that's the difference. Pain is a very subjective situation.
Right.
You know, what may be excruciating for you perceptually may not be for me.
Sure.
So it becomes very important in this whole concept of preparing the patient beforehand of what to expect, so that when they are in the recovery area, that they know that this is nothing unusual and they're ready to get up and walk around.
Right. Beautiful. Beautiful. So we'll talk to me a little bit about how many people are doing this, if anybody outside of you, versus people who are still on that narcotic protocol.
Well, we actually did a comparative study I did with another surgeon using my protocol and a normal routine, if you will, narcotic postoperative. And that study was presented by one of our residents at this meeting, I think a year or two ago. And is actually coming out in print in June of this year in the Aesthetic Surgery Journal. And it really has... People that heard the talk have asked me for it. Now it will be in print, and hopefully more people will be trying this and utilizing it.
Cool. So what's your hope for 5-10 years from now? Do you hope that this industry embraces a non-narcotic holistically for everybody?
I absolutely do.
Yeah.
I think that there may be the occasion when people do need narcotics, and I know that a lot of people are using a similar protocol but still adding narcotics. I'm hoping that we can convince those people that narcotics are just not necessary, and that we'll be continuing this work to see if we can even reduce the influences greater.
Cool. I love it. Let's take it back a little more. Talk to me about how this, you talked a little bit about how it came about and what inspired it, but the development of it, how did you come to the mixture of what you came to what is now your non?
I think that's exactly it is. It is a mixture. We incorporate obviously you want to stay current when you're in our field.
Yeah.
So the interest has already been there, and so I would pick something from one article, pick something from another article, and more or less put everything together. And now by using these medications and using intraoperative nerve blocks or long-lasting local anesthetics, it just kind of all came together into this protocol that just works beautifully for me.
Cool. I like it. Awesome. Anything else you want to share about it?
Try it. You'll like it.
Yeah. All right. Thank you. Appreciate it.
Yeah.